Question 1. A nurse is caring for 4 patients. Which patient should be assessed first? A. A patient with TB who has night sweats and a low-grade fever. B. A patient with TB who reports a persistent cough with blood-tinged sputum. C. A patient with TB who refuses medication due to nausea. D. A patient with TB who is scheduled for discharge later in the day. Answer: B. A patient with TB who reports a persistent cough with blood-tinged sputum. Question 2. Which task related to TB can the RN delegate to the licensed practical nurse, LPN? A. Teaching a patient about the side effects of isoniazid. B. Performing a Mantoux skin test. C. Interpreting TB skin test results. D. Discharging a patient newly diagnosed with active TB. Answer: B. Performing a Mantoux skin test. Question 3. A TB patient is placed on airborne precautions. What action should the nurse take first when entering the room? A. Don gloves and gown. B. Don surgical mask. C. Don N95 respirator. D. Sanitize hands. Answer: C. Don N95 respirator. Question 4. Which of the following indicates the need for immediate intervention in a TB patient? A. Fatigue and weight loss. B. Loss of appetite. C. Yellowing of the skin and scara. D. Mild headache. Answer: C. Yellowing of the skin and scara. Question 5. Which patient is at greatest risk for developing active TB? A. A 55-year-old with controlled hypertension. B. A 40-year-old on immunosuppressants for a kidney transplant. C. A 60-year-old with osteoarthritis. D. A 25-year-old with seasonal allergies. Answer: B. A 40-year-old on immunosuppressants for a kidney transplant. Question 6. A nurse is assigning care for a TB patient. Which staff member is best suited for this assignment? A. A nurse who is 6 months pregnant. B. A new graduate nurse without N95 fit testing. C. A float nurse trained in airborne precautions. D. A nurse with asthma exacerbation. Answer: C. A float nurse trained in airborne precautions. Question 7. Which symptom in a TB patient taking rifampin should be reported immediately? A. Orange-colored urine. B. Mild fatigue. C. Blurred vision. D. Loss of appetite. Answer: C. Blurred vision. Question 8. What is the most important instruction for a TB patient being discharged on medication? A. Avoid all physical activity. B. Take medications only when symptoms occur. C. Wear a surgical mask for the rest of life. D. Take medications exactly as prescribed for the full course. Answer: D. Take medications exactly as prescribed for the full course. Question 9. The nurse is caring for a TB patient with a productive cough. Which action reduces risk of transmission? A. Encourage deep breathing exercises. B. Keep patient room door open for ventilation. C. Ensure patient wears surgical mask when leaving the room. D. Use contact precautions only. Answer: C. Ensure patient wears surgical mask when leaving the room. Question 10. A nurse receives a positive TB skin test result in a patient. What is the nurse's priority action? A. Document the result. B. Begin airborne isolation immediately. C. Notify infection control. D. Schedule a chest X-ray. Answer: D. Schedule a chest X-ray. Question 11. A TB patient reports non-adherence to the medication regimen. What is the most effective nursing intervention? A. Reinforce medication teaching. B. Refer the patient to a DOT program. C. Increase dose of current medications. D. Ask family to administer medications. Answer: B. Refer the patient to a DOT program. Question 12. A nurse is caring for a TB patient who is also HIV positive. What is the greatest concern? A. The patient has mild diarrhea. B. The patient is coughing and febrile. C. The patient has a CD4 count of 500. D. The patient refuses to wear a mask. Answer: B. The patient is coughing and febrile. Question 13. A newly diagnosed TB patient is started on isoniazid. Which lab value requires immediate follow-up? A. Alt98 U/L. B. Hemoglobin 13.0 G/DL. C. Platelets 200,000/mm superscript 3. D. Sodium 138 milliequivalent/L. Answer: A. Alt98 U/L. Question 14. A nurse is preparing a room for a patient with suspected TB. Which room assignment is most appropriate? A. Private room with negative pressure. B. Shared room with a COPD patient. C. Positive airflow room. D. Room next to the nurse's station. Answer: A. Private room with negative pressure. Question 15. Which of the following is appropriate to delegate to a UAP caring for a TB patient? A. Assessing the patient's respiratory status. B. Collecting a sputum specimen using sterile technique. C. Assisting with oral hygiene. D. Educating about TB transmission. Answer: C. Assisting with oral hygiene. Question 16. Which statement by a patient taking TB medications requires further teaching? A. I will not stop taking the medication even if I feel better. B. I can take my medication with food to prevent nausea. C. I will drink alcohol occasionally while on these medications. D. I will notify my doctor if I notice yellowing of my eyes. Answer: C. I will drink alcohol occasionally while on these medications. Question 17. What is the priority nursing action when a patient receiving isoniazid develops numbness in the extremities? A. Encourage mobility exercises. B. Administer pyridoxine as prescribed. C. Hold the isoniazid dose. D. Notify dietary for B12 rich meals. Answer: B. Administer pyridoxine as prescribed. Question 18. Which TB medication is most associated with optic neuritis? A. Rifampin. B. Ethambutol. C. Pyrazinamide. D. Isoniazid. Answer: B. Ethambutol. Question 19. Which is the most effective method to ensure adherence to TB therapy in a homeless population? A. Provide written discharge instructions. B. Use a medication reminder app. C. Enroll in a directly observed therapy program. D. Dispense a 6-month supply of medications. Answer: C. Enroll in a directly observed therapy program. Question 20. A nurse notes a TB patient is spitting into tissues and discarding them on the bedside table. What is the best nursing intervention? A. Provide patient education on cough etiquette. B. Contact housekeeping to clean the area. C. Place the patient in contact precautions. D. Call the physician for medication adjustment. Answer: A. Provide patient education on cough etiquette. Question 21. A nurse is caring for a patient newly diagnosed with active TB. What is the nurse's initial priority? A. Begin discharge planning. B. Notify the public health department. C. Place the patient in contact isolation. D. Start corticosteroid therapy. Answer: B. Notify the public health department. Question 22. A TB patient is receiving pyrazinamide. Which lab value should the nurse monitor closely? A. Serum creatinine. B. Hemoglobin. C. Liver enzymes. D. Potassium level. Answer: C. Liver enzymes. Question 23. A TB patient complains of severe joint pain. Which TB drug is most likely responsible? A. Rifampin, B. Isoniazid, C. Ethambutol, D. Pyrazinamide. Answer: D. Pyrazinamide. Question 24. A nurse is reviewing TB test results for a group of patients. Which result indicates a need for further evaluation? A. 2 millimeters in duration in a healthy adult. B. 5 millimeters in duration in an HIV-positive patient. C. 8 millimeters in duration in a healthy adult. D. 10 millimeters in duration in a patient with no known risk factors. Answer: B. 5 millimeters in duration in an HIV-positive patient. Question 25. Which action best prevents the development of multi-drug-resistant TB? A. Avoiding direct contact with TB patients. B. Completing the entire course of prescribed medications. C. Using combination therapy with antibiotics. D. Monitoring vital signs daily. Answer: B. Completing the entire course of prescribed medications. Question 26. A TB patient is in respiratory isolation and becomes agitated, attempting to leave the unit. What is the nurse's priority action? A. Apply wrist restraints. B. Notify the physician. C. Administer PRN sedative. D. Protect staff and patients by reinforcing isolation protocol and de-escalating the situation. Answer: D. Protect staff and patients by reinforcing isolation protocol and de-escalating the situation. Question 27. Which instruction is most important for a TB patient taking rifampin? A. You can stop taking it once you feel better. B. This drug may cause your urine to turn orange. C. Avoid drinking milk with this medication. D. You must avoid direct sunlight while on this drug. Answer: B. This drug may cause your urine to turn orange. Question 28. A nurse is caring for 4 TB patients. Which one needs immediate intervention? A. A patient with a mild cough and stable vital signs. B. A patient who missed 1 dose of isoniazid. C. A patient who is nonverbal and unable to follow cough etiquette. D. A patient who has completed 6 weeks of therapy. Answer: C. A patient who is nonverbal and unable to follow cough etiquette. Question 29. A TB patient is refusing medications. What is the best nursing response? A. If you don't take these, you will get worse. B. You must take these or you cannot stay here. C. Let's talk about why you don't want to take them. D. These medications are required by law. Answer: C. Let's talk about why you don't want to take them. Question 30. The nurse is teaching a UAP about TB precautions. Which statement requires correction? A. I will wear gloves when I help with hygiene care. B. I don't need to wear a mask if I'm not coughing. C. I will sanitize my hands after leaving the room. D. I won't take food into the patient's room. Answer: B. I don't need to wear a mask if I'm not coughing. Question 31. A patient has latent TB. What teaching is most appropriate? A. You can transmit the disease through coughing. B. You will need long-term antibiotics immediately. C. You are not contagious, but still need treatment. D. You will need to be isolated until further notice. Answer: C. You are not contagious, but still need treatment. Question 32. A TB patient's sputum smear remains positive after 3 months of treatment. What is the most appropriate nursing action? A. Reinforce medication adherence and notify the provider. B. Place patient in contact precautions. C. Discharge patient with home isolation instructions. D. Switch to monotherapy. Answer: A. Reinforce medication adherence and notify the provider. Question 33. What is the primary goal of DOT, directly observed therapy, for TB patients? A. Prevent reinfection. B. Reduce medication costs. C. Ensure adherence to the medication regimen. D. Encourage hospital admissions. Answer: C. Ensure adherence to the medication regimen. Question 34. A nurse assesses a TB patient for hepatotoxicity. Which sign would be most concerning? A. Pale stools and dark urine. B. Increased appetite. C. Clear lung sounds. D. Decreased heart rate. Answer: A. Pale stools and dark urine. Question 35. Which TB patient can be removed from airborne precautions? A. One with active TB and night sweats. B. One who has been on TB meds for 2 weeks with 3 negative sputum tests. C. One who still has a productive cough. D. One with positive sputum smear and ongoing treatment. Answer: B. One who has been on TB meds for 2 weeks with 3 negative sputum tests. Question 36. A nurse is preparing to administer TB medications to a patient. Which action is appropriate? A. Administer isoniazid with a calcium-rich meal. B. Hold all TB drugs if nausea is reported. C. Give pyridoxine to prevent neuropathy. D. Double the rifampin dose if sputum remains positive. Answer: C. Give pyridoxine to prevent neuropathy. Question 37. A family member asks how TB is transmitted. What is the best nursing response? A. It is spread through direct contact with contaminated objects. B. It is spread through blood and body fluids. C. It is spread through airborne droplets when the infected person coughs or sneezes. D. It is a genetic disease and not contagious. Answer: C. It is spread through airborne droplets when the infected person coughs or sneezes. Question 38. A TB patient has been non-compliant and continues to visit crowded areas. What is the nurse's best response? A. Notify public health authorities. B. Educate the family about isolation. C. Restrict all visitors immediately. D. Increase the medication dosage. Answer: A. Notify public health authorities. Question 39. What is the best method to collect a sputum sample from a TB patient? A. After meals. B. After nebulizer treatment in the afternoon. C. First thing in the morning before eating. D. Before bedtime. Answer: C. First thing in the morning before eating. Question 40. A TB patient is due for discharge. Which statement by the patient indicates effective learning? A. I can stop my medications once I feel better. B. I must continue medications even if my symptoms improve. C. I will only wear a mask in the hospital. D. I don't need to follow up unless I feel sick again. Answer: B. I must continue medications even if my symptoms improve. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one.